Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I'd just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not replace, the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects as well as rare but life-threatening complications of therapy. Today we're going to talk about carboplatin and Taxol chemotherapy, which is given alone, but sometimes given in conjunction with radiation therapy. First, we're going to go over how chemotherapy works. To best understand how chemotherapy works and why we are recommending this treatment, you'll need a brief refresher course on biology. Don't worry, we're going to keep it basic. Remember, all living things are made of cells, and the blueprint for how a cell and our bodies are made is encoded in a molecule called deoxyribonucleic acid, otherwise known as DNA. We're now going to show a short video demonstrating these issues. So cancerous cells are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. The cell cycle goes from the resting phase through active growing phases and then to mitosis, otherwise known as cell division. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells, since the cancer cells divide faster and are therefore more susceptible to the treatment. Once again, here's a video showing the cell cycle in more detail. So chemotherapy works by scheduling the treatments based on certain factors, such as the type of cancer involved, the rate at which the cancer divides, and the time at which a given drug is likely to be effective within the cell's cycle. That is why chemotherapy is typically given in cycles. Cycles are simply treatments which are separated by time intervals. During this time, the cancer cells die while the normal cells have time to heal. When the healing of the normal cells is not complete, side effects occur. The normal cells most commonly affected by chemotherapy include blood cells, the lining of the stomach and colon, and hair follicles. This accounts for common side effects which can include low blood counts, mouth sores, nausea, and hair loss. Carboplatin is a drug you'll be receiving, and it's an alkylating agent. It binds to DNA in the cancer cell during the resting phase of the cell cycle. Normal cells can repair the damage to the DNA, but cancer cells divide too quickly and attempt to replicate prior to repairing the DNA, resulting in cell death. Taxol is the other drug you will receive. It belongs to a chemotherapy group of drugs called plant alkaloids. This is also known as an antimicrotubule agent or spindle fiber inhibitor. Spindle fiber inhibitors, such as Taxol, inhibit the microtubule structures within the cell. Microtubules are part of the cell apparatus for dividing and replicating itself. These spindle fibers help separate duplicated DNA into each dividing cell. Taxol inhibits this process, therefore killing the dividing cancer cell. Once again, here's a brief video demonstrating this process. The schedule of carboplatin is as follows. Both drugs are given together intravenously or IV every 21 days. When the drugs are given with radiation, the drugs are usually given once a week. Anti-nausea medications given by vein are given prior to administration of the drugs in the clinic. The carboplatin Taxol regimen takes about 5 hours to administer, less time, perhaps 2 hours or so, if given in the smaller weekly doses. Growth factors, such as Neupogen or Neulasta, may be given if necessary under the skin or subcutaneously to help your white cells or immune system recover as needed. Infusion reactions can occur with this regimen. An infusion reaction is a reaction that occurs during the treatment in the office. The symptoms, which can be caused either by Taxol or carboplatin, include flushing, shortness of breath, palpitations, or lightheadedness. Most reactions are mild and easily controlled, but very rarely can be serious or life-threatening. For this reason, you'll be closely watched during the initial portion of your treatment. Infusion reactions are reduced with steroids such as dexamethasone and by other drugs such as antihistamines, which may be used as needed. Here's a graphical representation of the schedule of carboplatin and Taxol. The top graph shows the every 3-week regimen. The drugs are given, and a day after or several days after, growth factors may be administered, namely Neulasta or Neupogen. Remember, this cycle or set of treatments is one treatment every 21 days. Alternatively, when given with radiation, the drugs are often given on a once-a-week schedule, and this is usually given weekly during the course of radiation, which is usually between 5 and 7 weeks. However, that can vary between regimens. Let's now talk about side effects of this chemotherapy regimen, that is, things you might notice once you go home. Remember, and most importantly, each person's reaction to chemotherapy is different. Some people have very few side effects, while others may experience more. The side effects described here won't affect everyone who has carboplatin and Taxol chemotherapy. One possible side effect is heartburn. This often feels like a pit in the stomach, or sometimes is mistaken as nausea. Importantly, it can be controlled with medications that block acid secretion into the stomach, such as drugs like Pepcid. Constipation or diarrhea may occur. Constipation is more common with this regimen, however, and can be treated with medications such as Miralax or by alterations in diet. Muscle pain or headaches can occur with Taxol or Neulasta. These are usually easily treated with pain medications over the counter, but occasionally require stronger medications. Issues with decreased kidney function or hearing loss are actually much more common with a similar but different drug called cisplatin. These issues are actually very rare with carboplatin. Hair loss will occur about 2 to 3 weeks after initiation of the regimen. Loss of hair on the head occurs first, but eyebrows, eyelashes, or pubic hair can be lost as treatment proceeds. Your hair will grow back at a normal rate after treatment, but at first it may have a different color or texture. Remember that the cost of your wig may be covered by insurance. Nail changes can also occur with Taxol. There are conflicting data regarding placing fingers in ice during treatment to help alleviate this issue. Maintain good nail hygiene and avoid false nails. Gloves may also help protect nails during work and sometimes at night. Mouth sores as well as nasal tenderness can occur and can be minimized with mouth rinses and non-alcoholic mouthwashes. Blood counts, especially white blood cells that help you fight infection, are reduced with this regimen. This usually occurs 5 to 7 days after treatment is given. You should report any fever greater than 100.5 or a shaking chill to your healthcare team. You may be given shots to help promote recovery of your immune system. Nausea is usually mild with this regimen and occurs maybe 6 to 48 hours after treatment. You will be given anti-nausea medications before your treatment by vein, and by mouth as needed thereafter. Carboplatin and Taxol chemotherapy can affect fertility. Talk to your healthcare team if this is an issue for you. During chemotherapy, you should practice adequate contraception. Numbness of the hands and feet can occur, which is usually an effect of Taxol on nerves, and this is called peripheral neuropathy. You may also notice that you have differences in fine motor skills, such as buttoning shirts or putting in earrings. It's important to report these symptoms to your doctor, as they may be controlled by slightly lowering the dose of the drug. This side effect usually improves slowly a few months after the treatment is finished. Taxol can also cause conjunctival irritation or irritation of the inner lining of the eye, causing red or itchy eyes. It can usually be treated with lubricating eye drops as needed. You'll receive one or more medications for nausea by vein prior to your treatment, and also receive prescriptions for anti-nausea medications to take by mouth as needed. If you do experience nausea at home, take these medications early and don't hope that it will get better without treatment. However, since they can cause constipation, you may need a mild laxative for example over-the-counter Miralax, to help combat that side effect. Medications that you may receive as an outpatient include Zofran or Ondansetron. You should take 1 tablet every 8 hours as needed for nausea. This medication does not cause drowsiness and can be a good choice during the day when you want to stay alert. Phenergan or promethazine is taken every 6 hours as needed for nausea. This medication can cause variable drowsiness in people, so be aware of this. Ativan or lorazepam is taken every 6 hours and almost always causes sedation. This can be a good choice at night when you want to get some rest. Let's review some commonly asked questions with regard to carboplatin and Taxol. Can I drive to my chemotherapy treatments? Well, we'd like you to have a driver for your first treatment. If you receive drugs such as antihistamines that cause sedation, you may also need a driver for subsequent therapies. Will I gain weight with steroids such as dexamethasone? These drugs can cause fluid retention and increased appetite in some patients. Be aware of your food intake as well as the quality of the food you're eating. For example, avoid excessive desserts, salt, or simple carbohydrates. Can I get manicures, pedicures, massages? Manicures and pedicures are usually avoided during aggressive chemotherapy. If you're receiving chemotherapy chronically, it may be possible to have manicures or pedicures, but you may want to bring your own tools and avoid cutting cuticles. Avoid skin scrubs if you have skin sensitivity on the palms or soles. Massage is usually very helpful during treatment, but avoid deep muscle massage if your platelet counts are low. Are there any food restrictions? Well, avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find, however, that you prefer cooler, lighter foods and meals during treatment. Smoothies with protein supplements can be a great choice, as can things such as Greek yogurt. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, however, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? We're going to discuss these dietary changes, but you may find that only certain foods appeal to you during your treatment and that your sense of taste has changed. Therefore, try not to be too strict with your diet during treatment and simply focus on healthy, non-processed foods. Should I take anti-nausea medications at home after my treatment? Well, this is often necessary or recommended as a preventative measure, and we'll review this with you during your office visit. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take extra vitamins or supplements? There can be significant interactions between supplements and vitamins and chemotherapy drugs. Please assemble a list of all vitamins and supplements you're taking. In general, we really prefer that these be stopped until after your chemotherapy is complete, to avoid any potential side effects or unknown interactions. They can usually be resumed after therapy has finished. Do I need a port or intravascular access device? Although we can often treat intravenously by simply inserting an IV catheter into the arm, ports may be required with poor or limited venous access, or for continuous infusion of drugs, or when the drugs are irritating the veins. We'll show a brief video at the end of this summary, which provides an overview of ports for chemotherapy administration. So in summary, chemotherapy is an effective medication because there's a therapeutic window. In other words, the drugs are specifically designed to be toxic to cancer cells, while your normal cells divide more slowly and have the time to recover from the treatment. The chemotherapy treatment and supportive medications, such as anti-nausea medications and shots to help your immune system, are delivered at specific times during each treatment or cycle, as denoted in your schedule. The side effects from chemotherapy are generally mild, self-limited, and managed with medications or behavioral changes. Severe side effects are very rare. But most importantly, if you ever have questions or concerns regarding your therapy or the symptoms you're experiencing, call your healthcare team. That is what we're here for. Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than ½ an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you will be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.